Okay, so imagine you've been diagnosed with a lifelong condition, like hypertrophic cardiomyopathy, or HCM. You'd need more than just a treatment plan, right? You'd need a map, a guide to help you navigate the road ahead, showing you where the potential dangers are and confirming you're on the right path. Well, for so many patients, that indispensable guide is echocardiography.
And look, that's not just a nice saying, it's a fundamental truth in cardiology. The word cornerstone is just perfect, isn't it? It's the foundational piece that the entire strategy for managing this complex heart disease is built on.
So, the big question is how? How can one imaging technique, which is basically an ultrasound of the heart, be so central to everything? How does it shape decisions from day one of a diagnosis to, decades down the line? Let's dive in and break it down.
Every journey has to start somewhere, right? For a patient with HCM, the whole management journey kicks off with that very first echo right after they're diagnosed. And this isn't about just taking a picture. It's about creating a personalized cardiac map for that specific person.
And it's pretty incredible what this first scan can tell us. Of course, they measure the thickness of the heart's walls, but they're also looking for any obstruction to blood flow as it leaves the heart. That's the LVOT gradient. You can think of it like a traffic jam right at the heart's exit. They also check something called diastolic function, which is really just a fancy way of asking how well does the heart muscle relax and fill up with blood between beats. These first numbers become the foundation, and they immediately help guide decisions like whether to start someone on beta blockers.
But here's the thing, that first map is just page one. HCM isn't a static condition. It can change and progress over time. And that's exactly why the journey continues with regular checkups, where the goal is simple but absolutely vital. Watch for any changes from that original baseline.
And there's a real rhythm to this surveillance. After that first baseline scan, there's a follow-up around 6 months later, then usually an annual check. As you can see, the echo pretty much becomes a constant companion, scheduled every 6 to 12 months or even more frequently if a patient's symptoms start to change. It's a consistent, reliable way to check in on the heart's journey.
So during these follow-ups, the clinicians are kind of like detectives going through a very specific checklist. First, they remeasure the wall thickness. Is it getting worse? Then they check that blood flow gradient again, sometimes even under stress, to see if a blockage is starting to form. They look at the diastolic function with a key metric called the E to E prime ratio. And finally, they check the size of the left atrium. A bigger atrium is a huge clue that pressure is building up inside the heart.
Now, routine monitoring is one thing, but sometimes the echo's role becomes way more urgent. This is where it goes from being a monitoring tool to a critical instrument that helps assess the risk of sudden cardiac death.
So, just imagine during one of those totally routine checkups, the technician sees something that just sets off all the alarm bells. The data from that echo can reveal specific, high-risk markers that demand immediate attention. And this is where a single number on a screen can literally change a person's life. One of the biggest red flags is a maximal wall thickness of 30 millimeters or more. Now, to put that in perspective, a normal heart wall is only about 10 to 12 millimeters thick. So this isn't just a little bit of thickening, this is a clear signal of very advanced disease and a major risk factor.
And here's the other critical number. Remember that blood flow traffic jam we talked about? Well, if the echo shows that the pressure gradient from that blockage is over 50 millimeters of mercury, it means it's severe. Blood is really struggling to get out of the heart, which puts this incredible, dangerous strain on the muscle with every single beat. And this is where you see the real power of the echo. When these high-risk features pop up on the scan, it immediately triggers a serious conversation about implanting an ICD, an implantable cardioverter defibrillator. It's a device that can literally save a patient's life. An image on a screen leads directly to a life-saving decision. It's just amazing. So the echo helps find the problem, but its job doesn't stop there. It's also absolutely essential for evaluating the solution. When a major intervention is needed to fix an obstruction, the echo is there before and after to measure just how successful it was.
And that intervention is called septal reduction therapy. This basically involves either surgically shaving down that thickened muscle, that's a myectomy,
or using alcohol to strategically shrink a part of it, which is called an ablation. The whole point is to physically get rid of that blockage we saw on the echo.
And this, right here, is the money shot. This is where the echo gives you the ultimate proof that it worked. A scan taken after the procedure provides objective, undeniable evidence. You can see it clear as day. That blood flow gradient that was dangerously high before is now low. And other problems caused by the blockage, like a leaky mitral valve, are often drastically improved or even gone completely. The echo gives the definitive thumbs up.
So, we've gone from diagnosis, through routine checkups, and even past a major intervention. But the journey with HCM isn't over. It's a lifelong condition, and that means the echo remains a steadfast guide for the long haul.
For the long term, the echo's job kind of shifts to watching for more subtle, late-stage issues. Doctors keep tracking those familiar things like atrial size and diastolic function, but now they're also hunting for new threats, things like an apical aneurysm, which is a dangerous thin bulge that can form at the heart's tip, or signs that the overworked heart muscle is finally starting to get weak. In this lifelong marathon, catching these things early is everything.
So when you put it all together, it's just so clear. An echocardiogram for an HCM patient is so much more than a static image. It's a living document, a dynamic roadmap that gets updated at every turn, guiding both the patient and the doctor through a really complex, lifelong journey.
And this story really makes you think, doesn't it? We've seen how this one imaging tool became an absolutely indispensable guide for one complex heart condition. So as our technologies get even more precise, more powerful, you have to wonder, what's next? How might this whole idea of a dynamic, personalized roadmap change the way we manage all kinds of chronic diseases in the future?